This is a critical review of the research article, Language Outcomes of Contextualized and Decontextualized Language Intervention, Results of an Early Efficacy Study. The authors of the research article are Sandra Lang Gillum, Ronald B. Gillum, and Kelly Reese. Okay. This critical review is presented by Research Group Number 4, Cindy Cockerham, Emily Floyd, and Lexi Russell. Specific language impairment population. School-aged children with specific language impairment can demonstrate difficulty comprehending and producing narratives. Their spoken and written narratives may contain fewer words, more ungrammatical utterances, and fewer story grammar elements than their same age peers. It is a rare occurrence for children with specific language impairment to demonstrate only one of these problems in isolation. Children that have a diagnosis of specific language impairment can have difficulties in one of the areas mentioned in the previous slide that can impact performance in another area. This can negatively impact the child's ability to benefit from classroom instruction alone. Some form of intervention is often needed along with classroom instruction to aid children with specific language impairment with improving their language skills. Okay. The general purpose of this study was to determine whether a contextualized language intervention or a decontextualized language intervention would result in the most changes in children's language and narration in comparison to a no-treatment control group.
The first treatment approach discussed in the research is contextualized language intervention. This is a specific teaching steps are used to train multiple linguistic targets or skills within activities that involve meaningful references to people, objects, and actions. Clinicians model and elicit language structure targets during functional and curriculum-related activities. This approach promotes a clinician-child interaction. The second treatment approach discussed in the research is a decontextualized language intervention. Children are taught language skills in discrete, teacher-directed activities with minimal topic continuity across the activities. A DLI session usually consists of short clinician-led activities that focus on a variety of specific skills with minimal continuity across topics that occur between the child and the clinician. Participants: 24 children with language impairment participated in the study. Children were eligible to participate if they obtained a standard score of less than or equal to 85 on the Clinical Evaluation of Language Fundamentals, 4th edition, or the SELF-4. None of the children presented with hearing or visual impairment, gross neurological impairment, intellectual disability, oral structural anomalies, or emotional social disorders. The children were randomly assigned to either the CLI or DLI groups. 8 children between the ages of 72 and 105 months received CLI, 6 males and 2 females. 8 children between the ages of 86 and 105 months received DLI, 4 males and 4 females. A control group of 8 children of the same age was drawn from a study in Utah, including 4 males and 4 females. Testing was conducted during the summer, so these children in the control group were not receiving language intervention or school instruction. The children in the control group were given the same measures as the treatment groups.
For the CLI intervention procedures, these children participated in a literature-based narrative intervention. Clinician and child discussions were centered on topics that were related to 4 different children's trade books that were about bedtime and parties. Specific intervention activities included listening to stories, answering comprehension questions, generating inferences, comparing and contrasting, discussing and defining Tier 2 vocabulary, and problem solving. For the DLI intervention procedures, The children were in groups and they answered questions and played games from the No Glamour series. The No Glamour series is a commercially packaged grammar game that contains situational drill cards designed to improve vocabulary, sentence complexity, and social language. The clinicians were instructed to engage in each game for an average of 12.5 minutes and provide feedback to the children. As noted previously, a main difference between CLI and DLI programs involved topic continuity versus discontinuity. In the DLI program, topics were discontinuous and each question had its own topic. Measures were used to assess the language outcomes of the children in the study. This included 2 sentence level measures from the SELF-4, that's recalling sentences and formulated sentences. So these measures assess the type of memory and sentence production skills taught in the DLI session. There were 4 narrative discourse level measures that were used from the test of narrative language. That's the narrative language index and the narrative comprehension. And also the monitoring indicators of scholarly language, the macrostructure and microstructure of the missile. These areas were selected because they assess comprehension similar to the activities presented in the CLI sessions. For dosage and attendance of intervention, it was provided in 50-minute sessions 3 times per week for 6 weeks for a total of 18 sessions. It was presented in small groups of 3 to 4 students by a certified SLP and supervised SLP graduate students. Children in the CLI group attended on average 17 of the 18 sessions, and children in the DLI group attended 15.5 sessions out of the 18, for an average. To ensure fidelity of this study, a script was provided to the clinicians to implement during the sessions, and the clinicians participated in training before intervention. A 10-item checklist was used also to ensure fidelity during the sessions. A mean fidelity score of 90% was obtained in both DLI and CLI sessions.
Okay, now we'll discuss the results of the study. ANCOVAs and CABAs were used on 6 dependent variables, which were 2 sentence level measures, the test of narrative language, 4 narrative discourse level measures, and the monitoring indicators of scholarly language, or the MISL, its micro and macro structure. This suggested that the data met critical assumptions for the analysis. A pairwise comparison for contextualized language intervention versus decontextualized language intervention and for decontextualized language intervention versus the control group was performed to assess the potential group differences. This comparison revealed that there was a strong relationship between group membership and the post-test scores for each significant group effect. Okay, the results of the sentence level measures are as follows. Post hoc comparisons for the sentence level measures revealed the CLI group's post-test scores on the recalling sentences and formulating sentences subtest were significantly larger than the control group's post-test scores. DLI's group's post-test scores were significantly higher than the control group scores for formulated sentences, but not for recalling sentences. Okay, and across the 2 sentence level measures, the effect size for the contextualized language intervention were 80% larger on average than the effect sizes for the decontextualized language intervention. Results of the narrative discourse measures. Post hoc pairwise comparison for each of the narrative discourse measures revealed a pattern that clearly favored the CLI group. Post-test revealed significant differences between the contextualized language intervention and the control group for the test of narrative language index, comprehension score, and the monitoring indicator of scholarly language, microstructure score. There was only a significant difference between the narrative performance of the decontextualized language and the control group for the MISL microstructure score. When combining the 4 narrative measures, the effect size for the CLI was almost 3 times larger on average than the effect size for the DLI.
Overall, this study was designed to assess a revised version of a narrative-based approach to the CLI that was included in a randomized controlled trial by Gillum et al. In 2008. When compared to the control group, the contextualized and decontextualized language intervention yielded statistically significant gains on sentence and discourse level measures. However, the effect size analysis indicated a larger effect for the CLI group when compared to the DLI group. The CLI and DLI interventions were shown to yield favorable outcomes for various targets, but the contextualized instruction might be a better match with academic instruction. The results revealed signs of efficacy for intervention that treats multiple linguistic targets in meaningful activities with high levels of topic continuity. This intervention is ready to be tested in a larger study with more internal validity after some additional revisions related to teaching narrative macrostructure. The researchers do plan to assess the outcomes of their approach to CLI in classroom intervention context.
Our general impressions of this study is that we judge the research design to be strong when compared to previous studies conducted. In regards to those previous studies, revisions were made to generate a stronger design to compare CLI and DLI and the improvement of language and narrative skills. Revisions from this study to improve the design are CLI to include fewer and less complex stories, more reading and writing in the activities, content from children's literature in all mini lessons, and specific language targets. Also, groups of students instead of a 1-to-1 clinician-child ratio, and a smaller scaled study with the intent of directly comparing language outcomes between CLI and DLI groups. In regards to statistical analysis, improvements were made by including the following: a nonverbal IQ into the statistical model to control for potential effects of factors related to intellectual abilities. A pretest performance was used as a covariate in the statistical model to control for effects of prior abilities. However, it should be noted that the information in this study is considered preliminary evidence of a revised approach and should further be researched on a larger scale.
This information can be used clinically in the following ways. Suggest changing stimuli when used when targeting complex grammatical structures or narrative comprehension, such as CARD versus CLI. Suggest that incorporating direct instruction of story grammar elements makes better progress in increasing complexity of children's oral narrative. Suggest that teachers and SLPs collaborate to incorporate specific language targets into various subjects like math and reading. Provide information on how CLI may fit more easily into the flow of ongoing academic instruction, and suggest group therapy is beneficial to children with a language